Because you're talking about early intervention.
Yeah.
Maybe you can just tell us how, is it very important to have early intervention, matters eye health care, or we have this culture in Kenya, ngoja kidogo, let's wait a bit, maybe it will clear.
Yeah.
So, how important is it to have early intervention?
Yeah. Okay. Yeah, actually, there's also another culture where it's another quote that says, if it is not broken, don't fix it. Yeah. If something is not bad, you don't want to touch it because, yeah. But it is very important that early intervention is incorporated into our health system. In fact, one of the things that the World Health Organization has advocated for moving forward from what was called the Vision 2020, which was running from 1999, is to be able to have what we call the integrated people-centered eye care. And this now focuses mainly on the patient, people being people having eye health literacy, so that they can be able to know what their eye health is all about. Like you have said, it is very important even for our daily activities. But now back to your question, early intervention is very important because it helps to have any defect, any disease to be managed earlier before they become unmanageable. Let me give you an example. Like, for example, a child who has, let's say, squint. The brain can be able to stop signals from that eyes, because squint can have other effects like double vision and all that. And so when the brain stops signal from that eye will not grow. So later in adulthood, that eye will become lazy, like it will not be able to see, because the brain was not able to send signals for it to develop. So early intervention is important, so that certain diseases can be nipped in the bud before they become unmanageable. Early intervention is also important, especially for children, so that they can be well prepared for the learning activities that they have, because learning requires different visual skills. The way you are seeing far, which referred to as visual acuity, it requires visual perception, which refers to how you perceive certain things, colors included. It also requires eye teaming. Eye teaming is where now the visual skill required to read books. Yes, so it's that coordination that can be able to help the eye read books. So those interventions can be able to prepare the child for those visual skills, so that they can be able to learn well.
Okay.
Yes.
What are these conditions that arise for not taking the child for early intervention, like the lazy eye? I know you have told us about the lazy eye, but what could problems like, say, low vision or something, vision impairment arise? What are these things that would arise for not taking appropriate action?
Of course, the worst that could happen is blindness. It is on record, of course, with the World Health Organization, that the main cause of blindness in Africa, and of course in third world countries, is uncorrected refractive error, which short-sightedness included, long-sightedness, and also the other one is cataract, which of course affects older people. But of course, one of the conditions that can cause problems when it is not managed is, of course, refractive errors. The other one, of course, is amblyopia, which is the lazy eye. This one usually comes towards adulthood, where now, of course, the brain does not send any signal to the eyes, and so the eye do not develop, and so that eye will become lazy to not see totally. There could be childhood cataract. Somebody is born with cataract, and that eye might never be able to develop. So that early intervention will ensure that the cataract is removed, and then the eyes can resume their normal development by relying on the stimuli from the brain.
Okay.